Thank you so much. It's really a pleasure to be here, and it's a pleasure to participate in this fantastic conference. The Federation of Medical Women of Canada is the equivalent organization in Canada to AMWA, and I have the honor of being a past president. In terms of disclosures, I do want to disclose that in our advocacy campaign, which I'm going to tell you about, Merck Canada did give the Federation a unrestricted educational grant. So the Federation is the voice of women doctors in Canada, much like AMWA, and has been around since 1924. We're a little bit younger than you, but not much. When women physicians could not get privileges at the various hospitals because they were women. And the Federation really gives us the opportunity to take part in initiatives around women's health, both locally, nationally, and internationally. And like AMWA, we're a member of the Medical Women's International Association with a voice at the UN and the WHO. And because we have this voice, we felt it was very important to be a leader in advocacy around HPV and HPV education and prevention. And so what we wanted to do is we wanted to look at what we were doing in Canada and really set a standard for what could be done around the world. In Canada currently, we have cervical screening guidelines and programs, and women are advised to be screened approximately every 3 years if they're healthy, starting at age 21. And we have seen a cervical cancer decrease of about 2.1% between 1992 and 2005. But even in Canada, with socialized medicine, where women can get Pap tests with their physician, we still lose about a woman a day, about 350 women per year, to cervical cancer. Just to put that in context, a couple of years ago, I was honored to speak in Indonesia. And Indonesia is a country that is approximately 8 times the size of Canada, about 250 million people. And if we lose a woman a day to cervical cancer, 1 a day, it would be not unexpected to think that they would lose approximately 8 women per day. And at that talk, where I was honored to speak to the minister in charge of cancer and the minister in charge of vaccine, both of whom had never spoken to each other because they looked at vaccine as childhood and cancer as adult, they acknowledged that they had 35 deaths a day. So it shows you the impact of screening, and it shows you the impact of prevention. Well, we have had the public program for HPV vaccine now 10 years in the school system, and I'm honored to tell you that as of this past September, in every province and territory in Canada, so that is throughout the country, HPV vaccine is given under the public health program to boys and girls. We're the second country in the world, Australia being the first, that is now immunizing boys and girls in the school system. We're trying to normalize this. It becomes routine, and it becomes routine like hepatitis B or some of the other vaccines that's given through the school system. And we have already seen a reduction of CIN2 in British Columbia. We've seen a reduction of anal genital warts in Ontario, and we've seen a decrease in prevalence of HPV types within the 4-valent vaccine found in Quebec. So where do we stand? We thought this is pretty good. Aren't we doing a great job? And the answer is, unfortunately, even though we have it in the school systems, and even though we have accessibility to vaccine, we don't have 100% uptake. And so we felt that there was a real need to advocate around vaccine, both for our own country, but also for the rest of the world. And so with this unfinished business, what we, the Federation, decided is that we need to move forward to talk about HPV not just to each other, not just to an educated audience like this, but to the public. Because even in our school programs, we don't have 100% uptake because parents don't understand the issues around vaccine and the issues around HPV disease. And so this is our school program, and I am proud to show this to you, but I do also show it to you that each province, like each state, does things slightly differently. Some are using the 9-valent, some are using the 4-valent, some are using it in grade 5, grade 4, grade 7. It still is a bit of a patchwork, which is hard for the public to understand, because although we have a national health program, it's implemented differently in the provinces and territories. And so what we did as a federation is we took on this huge task for advocacy, and we went to our parliament. We went to the equivalent of Congress, and we spoke to all four parties, and believe it or not, we had all four parties agree on something. You can imagine that that is difficult. We had one of our MPs named Peter Kent, and I say his name really with pride. Peter Kent is an MP, which is the equivalent of a senator, and he spoke on the floor of Parliament, like speaking on the floor of Congress, about his own episode of oral HPV and how important he felt it was for his parliamentarian colleagues to understand that this could happen to anybody. And so with all party agreement, we announced in Canada in May of last year that the first week in October would be HPV Prevention Week, and that every October going forward, we would have a week on education, a week to talk to the public, to talk to colleagues, to talk to all the different organizations involved, and we have parliamentary support to do that. And so moving forward, our theme was all about collaboration. Our theme was that we needed to involve everyone, doctors, nurses, public health officials, pharmacists, politicians, NGOs, that this wasn't just a women's issue. It wasn't just a federation issue. It wasn't just a doctor's issue. It was an issue for everyone. The goal was preventative health care and to close the gap, to encourage behavior that could ultimately save lives, and to communicate, to be a communicator around our country, to communicate internationally, and to model for Canadians how we can spark a global conversation on HPV disease prevention. The hashtag was #Canada versus HPV, and what we're hoping, and I'm hoping to post an invitation in the upcoming Medical Women's International Association newsletter that says we want it to be #USA versus HPV, #Australia versus HPV, #Indonesia versus HPV. Our hashtag is now HPV Prevention Week 18. It's no longer 17. We've grown a year. And we want to use our resource material from our website to add your voice to ours and to help spread this end of infection. And so what we are doing is really looking at our colleagues who are expert in social media. And I was here yesterday as Amanda was trying to teach us very quickly how to do things privately on social media. We're trying to look at mainstream media. We're trying to look at where people look for information and provide credible information. And so this is what the logo looks like, representing 6 different cancers. And this was the poster that we sent out to 35,000 family doctors in Canada. The poster was meant to be a talking point, and it went out a month before the actual HPV Prevention Week. And what we wanted to do is we wanted to highlight all the different groups that were working with us. And so the SOGC, which is a large organization in Canada like ACOG, the Society of Obstetrics and Gynecologists of Canada, we had partnered with pharmacists, with nurses, but our most important partner was the Public Health Agency of Canada, which means we partnered with public health so that every public health unit across the country was giving the same message to all the people that they were seeing. Because we grow strength when we partner, we cannot work in isolation no matter what it is that we're trying to achieve. And yes, we did partner with industry as well, who supported us by giving us some funding so that we could send out some of the information. Well, how did we do? It's a year later. Very quickly, I just want to show you that we had planned, starting September 25th, so a week or two before the week, we planned our social media campaign. We knew what was going to be said, so we could tweet it, we could get it out, we could have it on Facebook and everywhere else. We then looked at how we did, and we ended up with more than 28 media placements. We had over 8 million impressions across the country, and our coverage in media outlets was thought to be excellent. It was considered Tier 1. It included a call to action. It included the brand mention of HPV Prevention Week. And 100% of the media surveyed said that we were balanced in nature, that we were not biased, that we were not promoting one specific vaccine, that we really were giving the public a credible, balanced message. And I think this is so important when we look at media today and how things can be misinterpreted. When we looked at our PAP campaign, which comes after our HPV Prevention Week, it was not as robust, and we're looking to improve that in the future. And when we looked at how we did, this was just a comparison, the overall coverage was excellent. And so what we tried to do was learn very quickly how media works, and what we tried to understand was how traffic works, who the audience was that we were getting, how we were engaging people, how we could look at industry benchmarks for other issues, and how we could actually learn last year and do better this year. Traffic essentially was often through social media, although we did a number of things with mainstream media as well. But the bottom line is we learned a lot from what we did last year, and we want to share that with you. We want to share, these were the countries that picked up different views. So we had views in the US, we had views in South America, we had views in Europe. This local campaign in Canada, and we're a small country. You know, we are a very small country. We're big in land mass, but we only have about 35 million people. That's about the size of California. So realistically, we were really excited that as far as Australia and in Africa and in the UK, we got traction. And we hope that this year we're going to do even better. And I'm going to end off by showing you just state by state. It's all light blue. We didn't have a huge impact in the US, but hopefully you'll join us this year. Hopefully you'll look and say, maybe AMWA wants to be part of this, and maybe you want to do USA versus HPV. You know, we often compete with you. We often compete at the Olympics. Your girls won the hockey this year. We are still crying about that at home. But we often collaborate. And what we do best as physicians, what we do best as female physicians, what we have learned over the years, no matter where we come from, is when we collaborate, we do so much better. Thank you so much, and I hope you'll join us.